When arriving to an emergency scene, it's very important that you first size up the scene. And once you've sized up the scene, you can then ask the victim for consent. And once the victim has given you consent, you can call 911 if needed. Before putting on your gloves, it's very important that you wash your hands or use Germ-X to prevent the transmission of diseases. And after sizing up the scene, receiving the victim's consent, and putting on your gloves, you can then assess the victim. And you can begin by checking the victim's complaint. And in this case, the victim complained of her forearm, and she has a shallow laceration, which is a cut of the skin with a jagged edge. So what we're going to do is we're going to take a sterile gauze, and we're going to grab it by the corners. And you want to make sure that the gauze is large enough to cover the entire wound. And we're going to place it directly over the wound and apply pressure to control the bleeding. And once the gauze is over the wound, we can then take gauze bandage and start farthest away from her heart. And we're going to use a spiral method. And we want to make sure that the bandage is tight, but not too tight that it's going to stop her circulation. And as we're wrapping, we can talk to the victim and let them know what we're doing. And to ensure that the wrap is not too tight, we can check her fingers to make sure they're not blue or purple. And once we're done wrapping, we can use tape to tape it off. And once we're done wrapping the wound, we need to properly dispose of our gloves by pinching at the wrist and pulling it inside out, and taking our 2 fingers and pulling downward without touching the outside of the glove. We need to properly dispose of those in a plastic bag to prevent the spread of diseases. And once we properly dispose of our gloves, we can wash our hands with warm water and soap or use Germ-X.